Studies show a strong connection between a history of trauma and the development of BPD, borderline personality disorder. Let's unpack that. So the prevailing understanding in psychology is that BPD is a complex disorder rooted in a combination of biological vulnerability and environmental factors, with trauma being a primary environmental factor that interacts with this vulnerability. So the relationship is often explained through the biosocial theory developed by Dr. Marsha Linehan. She's the creator of DBT, dialectical behavior therapy, which is seen as the gold standard treatment for BPD. So first, there's a biological vulnerability, which is an inborn sensitivity. So individuals who develop BPD often have an innate biological sensitivity to emotional stimuli. This means they are born with high sensitivity. They notice subtle emotional cues that others miss. They're also born with high reactivity, so they experience emotions with greater intensity than others. And they also often have a slow return to baseline, so their intense emotions take a longer time to calm down than someone without BPD. This inherent emotional intensity then creates a need for an extremely validating and stable environment. Second is the environmental factor, so trauma and invalidating environments. When an emotionally vulnerable child is raised in an invalidating environment, the groundwork for BPD is unfortunately laid. So trauma, especially like severe or prolonged child abuse, neglect, or loss, is the most extreme form of invalidation. When we say trauma, we're including physical, sexual, or emotional abuse, severe neglect, or chronic emotional deprivation. Trauma is the ultimate emotional invalidation because what the child is learning is that their feelings, needs, and safety don't matter. When it comes to invalidation, when a child expresses a deep, intense, natural emotion due to their biological vulnerability, the environment dismisses, punishes, or minimizes it. Maybe they're told, "You're just being dramatic," or "Stop crying, it's not a big deal," or "Stop crying, I'll give you something to cry about." Or maybe they're punished for expressing their grief or fear. So the result is difficulty regulating emotions. So the combination of an intense biological system and an environment that fails to teach the child how to manage that intensity leads to the core feature of BPD, emotion dysregulation. So the person never develops effective skills to understand, label, or moderate their feelings. They learn to cope by using extreme behaviors like self-harm, impulsive actions, or intense relational conflicts in an attempt to get their environment to respond to their profound internal distress. So the world and relationships feel perpetually unsafe and unpredictable, leading to the characteristic BPD symptoms: fear of abandonment, unstable identity, chronic emptiness, and volatile relationships. Now, as I said, not every individual with BPD has a clear trauma history. The rates are staggeringly high. From what we know, 70 to 80% of people diagnosed with BPD report having experienced childhood abuse, neglect, or separation from caregivers. In one meta-analysis, which is a study of the studies, 83% of people with BPD reported having experienced at least one form of childhood trauma. Because of this profound link, BPD is often conceptualized as a severe, complex reaction to early, overwhelming stress and relational trauma. For those without trauma who have BPD, there are other factors that could be driving the diagnosis, so it's not 100%. But if you want more on that, check out my series on the 4 causes of BPD for more information on this.